Drug interactions with epinephrine and levonorepinephrine depends on number 1, non-selective blockers. Number 2, tricyclic antidepressant. And this interaction may result in increased blood pressure. Reduced dose of epinephrine is warranted, and levonorepinephrine is contraindicated. There are 6 examples of tricyclic antidepressants, and these are: number 1, imipramine. Number 2, amitriptyline. Number 3, desipramine. Number 4, nortriptyline. 5, doxepin. And number 6, protriptyline. Number 3, drug interactions with epinephrine and levonorepinephrine is general anesthetic. Interaction may result in serious cardiac dysrhythmia. Anesthetists should be advised as to whether epinephrine is needed in local anesthetic. Epinephrine should be limited to 1 microgram per kilogram if thiopental is used, and 2 microgram and kilogram otherwise. Example of general anesthetic is halothane. And the 4th, drug interactions with epinephrine and levonorepinephrine is cocaine. Interaction may result in increased blood pressure and cardiac dysrhythmias. There are 4 factors to be considered in using local anesthetic in dentistry, and these are: malignant hyperthermia, interactions, vasoconstrictors, and topical anesthetics. Malignant hyperthermia can occur when patients with genetic susceptibility to this condition are exposed to inhalational general anesthetics or succinylcholine, but not to local anesthetics. Previous recommendations, now known to be wrong, precluded the use of specific local anesthetics in these patients. Today, it is well accepted that all local anesthetics are safe for patients who are susceptible to malignant hyperthermia. Unlike the vasoconstrictors in dental cartridges, local anesthetics have very few clinically significant interactions on their own. When they are combined with an opioid and an antihistamine, there may be a predisposition to seizure activity, particularly in children. This concern can be minimized by the use of low doses and careful monitoring, consistent with the standard of care for oral sedation. Vasoconstrictors are invaluable to local anesthesia in dentistry. There are clear indications for their use, of which improving the depth and durations of anesthesia are the most important. Without them, local anesthetics have a very short duration of action intraorally. Vasoconstriction is more important for infiltration techniques in vascular sites than it is for mandibular blocks. The presence of vasoconstrictor may also reduce systemic toxic effects and can provide hemostasis. The most common agent for this purpose is epinephrine, which is available in formulations of 1:50,000, 1:100,000, and 1:200,000. Vasoconstriction is due to epinephrine's stimulations of alpha-1 receptors in mucous membranes. However, it also stimulates the beta-1 receptors in the heart, increasing heart rate, strength of contraction, and myocardial oxygen consumption. And the beta-2 receptors vasodilating blood vessels in the skeletal muscle. These actions form the basis for potential interactions with other drugs that affect the same receptors. A second vasoconstrictor is levonorephrine, which is available as a ratio of 1:20,000 solution and should be considered equivalent to 1:100,000 epinephrine. Levonorephrine is contraindicated for patients receiving tricyclic antidepressants. Epinephrine dosage should sometimes be minimized. For example, for patients with significant cardiovascular disease, in particular, ischemic heart disease. Topical anesthetics may be indicated to minimize the sensation of needle insertion or for very brief relief from painful mucosal lesions. Their effectiveness in preventing pain due to injection is equivocal, but they may be of value for many patients. For this purpose, benzocaine is available in concentrations up to 20%, and lidocaine is available as a solution or ointment in concentrations up to 5%, or as a spray at the concentrations of 10%. Dentists should be aware that excessive doses may lead to toxic effects, particularly in children. There are 8 treatment modifications to consider if there are concerns regarding vasoconstrictors. And these are: number 1, monitor blood pressure and heart rate preoperatively. Number 2, minimize administration of epinephrine or levonorephrine. Number 3, monitor blood pressure and heart rate 5 minutes after injection. Number 4, may re-administer epinephrine or levonorephrine if blood pressure and heart rate are stable. Number 5, continue to monitor as required. Number 6, consider limiting epinephrine to 0.04 milligram, levonorepinephrine to 0.2 milligram. And number 7, avoid epinephrine, the ratio of 1:50,000. And number 8, never use epinephrine impregnated retraction cord. Examples of calculations of doses of vasoconstrictors will be included in Part 4 update of local anesthetics in dentistry.